Jeff is coming in by Zoom as well, so he is watching, and he may jump in and intercede on something if he needs to. But anyway, so members of the public have started to inquire about Kenwood Cove for 2021. The 2021 season is planned for May 29th to August 15th, 2021, and the ongoing impacts of COVID may necessitate a modified plan for 2021. As you're aware, the operation of Kenwood Cove requires a significant amount of personnel, supplies, repairs, utilities, and maintenance to open. Traditionally, Kenwood Cove has recovered most of its operating costs, with the exception of the ongoing support from parks, facility maintenance, and utilities departments personnel. As you may or may not be aware, there's a staff member from utilities that helps serve as a pool technician for 6 months to ensure exceptional water clarity, chemical control, and smooth mechanical operation. The proposed modified plan for mass gathering and social distancing will decrease typical revenues, and we will not recover our budgeted expenses. We are aware that the commission will be talking about this later on this afternoon, so obviously this may change. Staff recruitment started in January. Staffing lifeguards will continue to be a challenge for the 2021 season. On the next slide, you have our historical expenses and revenues. Does anybody have any questions, or I'm sure you don't want me to read these line item by line items, so does anybody have any particular questions on our historical expenses and revenues? Yes, sir.
Just one, is there any reason that the maintenance fund is not a budgeted expense, for lack of a better term?
But we budget an allocation out of the sales tax fund on an annual basis to then fund the maintenance fund, and so then we spend out of that. I'm not sure if...
So that, what, doesn't, notice that the expenses notes does not include the Kenwood Cove Maintenance Fund?
Correct. We draw down on that fund occasionally, not on a regular basis. In fact, one of the items you have on your agenda today is replacing the Diamond Bright surfacing in the river walk, or the lazy river area, which will be an example of kind of a item that we've saved up in the maintenance fund for, and then we'll make an expenditure on a as-needed basis rather than an annual allocation.
So that's just and like an escrow fund for
Correct.
the big ticket.
Yes, sir. We don't
Correct.
use it for day-to-day operations.
If I might chime in, the maintenance fund is actually set up under a state statute that allows capital improvement funds, and you budget the transfer into that fund on an annual basis, but when you expend out of that fund, it is not necessarily, it's not a budgeted expense. So you budget the transfers in, and then you can, after you've accumulated money for 10 years, you can spend it, but you don't have to budget that expenditure ahead of time. So that's why it's kind of...
So the difference here is it's just coming in from a source other than from the regular budget?
Yes.
Correct. And this notation's to call out the fact that that fund is available for individual uses.
Okay, thank you.
Any questions on the revenues back through 2017? Okay. So on the next slide, you'll see our normal season operating parameters, Monday through Saturday, 12:30 to 7, Sunday, 12:30 to 6, and then we have our fee structure here. Any questions on that?
The water walking, is that, do we charge for the water walking, those people that come in, is that one of
Yes,
just the
sir.
regular day pass fee?
They can either get I believe it's a 10 or 20 punch pass or a day fee.
Okay.
On the next slide, you can see comparable day pass fees of other aquatic facilities. So you notice that Rock River Rapids in Derby is $8 for youth, $9 for adults. Seniors are $8. And then we go all the way down to Wichita, the College Hill Pool, which is $2, $3 and not applicable. College Hill Pool is more like a pool. It's not necessarily a water park. Just wanted to point out the different fee structures. The average day pass rates are $450 for youth, $552 for adult, $286 for seniors. And as you can see, we fall right about in the middle. We do think it's important to point out that in 2018, Kenwood Cove was named by MSN Insider as the #1 water park in the state of Kansas. Hopefully we can continue that tradition this summer. Comparable facility entities, Manhattan, Hayes, McPherson, Hutchinson, Derby, and Dodge City. They are all have different, no two facilities are identical, but they all have several amenities that are similar. Our next slide, our normal season daily staffing levels. You can see what it takes to run.
Can I ask a question here, Mr. Cotton?
I'm sorry.
So, are we to assume that you are making budget with these numbers, or are they subsidizing those fees for aquatics facilities?
Commissioner Ryan, I apologize, we can tell you're talking, but due to sound quality on this end, we can't make out what you're saying. We're still trying to troubleshoot that.
I think he was asking if they're subsidized,
Yeah,
Yes.
the
and I
other,
don't,
the other
and I don't
facility,
know,
Whether the other pool facilities are subsidized?
right?
right,
Oh, I can find that out. We don't know what their cost recovery is, sir, but we could definitely look into that.
Mm-hmm. Thank you. Yes.
Okay. Okay, next is our current lifeguard pay rate. You can see the 3 different tiers we have there for staffing. And then over to the right, you can see what the lifeguarding starting rate of pay is in other communities. And then you can also see what comparable jobs in Salina for the age range are. So you can see who our competitors are for staffing. So when I was coming up, my career started as a lifeguard, so I loved it. But that's changed, and not as many kids are willing to sit in the sun all summer for that rate of pay as they were back in the day. So you can see what we're up against. Yes, sir.
Are most of our lifeguards high school students or college students?
We
Or
have
in that age group?
It's that age group, yes, sir. We don't have a lot of what I consider adults. We have a lot of college kids, and when they go back to school, then that really puts us in a bind to continue operations.
So is this their major summer job, or the reason I'm asking, looking at the rate of pay, it's, they could probably find a job making more. Is this enough to where we get enough applicants as their major summer job that?
This has been an ongoing issue since before I was hired to come to Celina. Keeping a full staff at the water park has been a challenge every year. I can't say when it first opened, when it was brand new, but I know even when I was still working in another community, I got calls from the media about staffing problems here. So it's been an ongoing issue, just to keep up with, I guess we can call it keeping up with the Joneses on the part-time pay rate.
I don't know if you can hear me, but I'm going to go ahead and try to ask this question. I noticed that we have the YMCA listed here. Do we have any sense of what Great Life or the country club is paying its lifeguards? Are we competitive with those wages?
I don't know that off the top of my head, but I can certainly research that for you.
Does Jeff?
I would just be curious. I mean, in terms, if the supply pool is super limited, I would just want the city to be the preferred employer.
Yes,
and-
ma'am. Jeff,
Thank
do you
you.
know the answer to that question? I know you're on the line.
Well, we could make out the mayor, but we could not make out you, Jeff.
Sounded like they don't share the information.
Yeah, he said they were
You
reluctant
guys
Yeah,
do
he
to
said
better
he
than me,
didn't share the
man, in
information.
deciphering that.
I would think it'd also be interesting to see what Lynchburg does because of the proximity, if we were to try to entice some of those individuals to drive 15 minutes to work.
On the next slide, our 2021 lifeguard recruitment status. We currently have, as of March 10th, we have 22 lifeguards returning. We have 18 new candidates. We have 5 returning in maintenance, 4 new maintenance candidates, and then we have 5 cashiers returning with 3 new cashiers on the line. And then we have lifeguard classes scheduled for March 15th, 16th, and 17th. And we are teaching these classes now ourselves. Andrea Lema is our new aquatics supervisor, and she's certified to teach classes. So where in the past, Jeff didn't teach, he just recruited, Andrea is able to teach those classes for us now and help with that recruitment effort. Next is our historical total payroll breakdown. As you can see, our 2019 expense, our total payroll budget was budgeted for $277,000. Our actual payroll spent was $229,476 for a variance of $47,523.64. And then we have the historical payroll expense, but our average budget is $294,667. Our average regular pay has been $238,456 with overtime pay of $9,613. One of the reasons, I know we've been asked this in the past, one of the reasons we haven't spent all of our allotted budget is we just haven't had enough people to spend it all. Plain and simple, we just haven't had the bodies. Any questions on that?
Is that what you're saying? That's the reason for overtime, is from the lack of
Yes, sir.
full-time staff? Okay.
Not just that, not just the going over on the overtime, but also not spending all of our historical regular pay because we haven't had the bodies there. Mayor Hodges, were you saying something, ma'am?
Yes, I just had a question. So is the 265 that's budgeted for this year, is that just plugging in our new hourly wages into what we've typically done in the past, or does this reflect the shifts that you have proposed in 2021's operating model?
I'm sorry, I'm having a hard time hearing you. Were you asking if the 265 is budgeted for normal wages?
Yeah, I wanted to know first, does that reflect the, were we doing a wage increase for the lifeguards this year? Or did I miss that?
It does. Yes, ma'am. The payroll budget is for 265. Yes, ma'am.
Okay, so does that reflect like 2018 and 2019 staffing schedules, or does it reflect the 2021 standard shifts that you're proposing that we adopt? I don't know if I asked that.
No, I think I understand what you're asking, ma'am. Let me turn that one question over to Jeff, because I know Jeff crunched these numbers for the PowerPoint. He worked pretty hard on this. Jeff, do you have that off the top of your head?
Yes. Excuse me. The $255,000 budgeted, and it was so to accommodate the pay increase that we gave in 2020.
Right.
So we cover a 50-cent increase, sorry, a 25-cent increase in 2020. There's not a scheduled pay increase for 2021, so we feel comfortable that we're going to cover that budgeted amount will cover all of our payroll for this year. It's not changed based on what we're proposing today. If that helps answer the question.
I think it does, Jeff. And so basically this 265 number is just, pretty much it aligns with what we've done in past years, but it doesn't necessarily reflect this year's operating model.
That is absolutely correct.
Okay, great. Thank you. Thank you. That's all I needed to know.
Yeah, and for what it's worth, this operating model was developed after the budget was set, and as we are going into this year, recognizing we may still be in for impacts of the pandemic.
Okay, on the next slide, we have our average attendance, day passes, and memberships. Our operating days, total attendance down over the years. As you notice, 2014, we had over 81,000 people visit, and that number fell down to 2019 by about 10,000 people. So part of that can be attributed to the staffing issue with us not being able to open some amenities. People went elsewhere. Any questions on that?
I
On
would
that slide?
suggest probably the first year or two, there was a novelty
Yes,
feature
sir.
also. It was new, people wanted to go there, and we probably had, the first 2 years were probably a little bit higher than we should expect on a regular basis.
And one of the attractions that wasn't working when I first came to town was, I don't know if you're familiar, we had the river slide wasn't functioning properly. About 2 years ago, that was rebuilt, and now it does operate. However, like most attractions, in the future, we will need to freshen the water park, maybe add a new feature at some point in time to help bring those people back.
And you might also speak to what the staffing did to us in terms of having to close portions of the pool and then the frustration that created for some of our patrons.
Correct. So as I've mentioned, the last couple of summers, we've had issues keeping staff on all summer that has resulted in us needing to close. Most frequently, the lap pool was closed so that we keep the slides and the lazy river open. Those are our two biggest attractions. However, not having the lap pool open did cause some discontent, and some people didn't come. Hopefully, we can address that this year and keep everything open. Proposed operation plan for 2021. Everybody's aware of the public health order, so I know that, again, I mentioned this earlier, I know that this is going to be on the agenda for later discussion today, and I'm sure that after today's meeting, we might have some different direction on this, so I'm not going to read that. Does anybody have any questions on that? We are planning to limit Kenwood Cove operation by 2 sessions, 3-hour blocks of time to help with the social distancing if we go as we have been, unless that changes again. But we would limit the occupancy to 600 per session as opposed to our normal operating operation of 1,200 people. Yes, sir.
Do most people tend to stay 3 hours or less, or are there a fair number of people who make it a all-day outing?
There are a fair number of people that make it an all-day event. However, based on the current situation, it'd be very difficult for us to do that and keep things clean in between. We want some of that downtime to sanitize and clean the facility.
But, okay. I was just going to ask, if they wanted to stay all day, would they have to pay another?
Yes, sir.
They'd have to
If they,
buy 2 passes.
we'd have everybody leave the water park and then come back in.
Come back.
Yeah, and I think part of this is directed at that limited access, the limited ability to take use of the facility. And so trying to break it into 2 blocks, give everyone an opportunity to utilize the facility in this format thing kind of causes a reservation system and a limitation that if you wanted to take advantage of both, you'd have to go through this process and pay both times.
So is there any thought as to what hours each session might be? In other words, you say 2 3-hour blocks. Is that like from 1 to 4 and 6 to 9 or whatever?
Actually, yes, sir. We have that schedule in here. I'll
Okay. Oh, okay.
do it in just a moment.
I'm ahead of you. I'm sorry.
That's okay. That's okay. We have had some discussion about the queue lines for the entrance, the slide tower, the diving board, all the attractions. We think it'll be relatively difficult to enforce the social distancing for all of the queue lines. We just want that to be clear up front. We'll do our best to address that. Personally, I visited several other water parks last summer to see how they were doing things, and that was a challenge at all of those facilities. So even though we will do our best to address it, I just want the commission to know up front it will be a challenge for us.
And I presume that if you're a patron in the water park, you're not going to be required to wear a mask,
Correct.
because it's going to be hard to be in and out of the water and so on. And
Yes, sir. We don't want anybody with a mask on in the water.
Yeah. Okay.
But now that's, I think, a little different from the situation you just, but if they're in there but not actively participating in the water, when I remember it, they're supposed to have their mask on.
Well,
Correct?
I'm just saying that's going to be pretty difficult. If you got somebody who's standing in line for a slide and they're going to slide, it's pretty hard.
Oh, no,
for
not where they're
them
standing.
to have a mask on in line, take it off to slide down and put it back on. Now, if they're sitting at a cabana and they're sitting there, eating lunch or drinking soft drinks and chatting, then maybe they should have a mask on. But if
I'm
they're
sorry, yeah, it says
actively
the-
participating, it's going to be hard to require them to.
Yes.
Like
We're already
in the
short-staffed.
non-aquatic areas.
Yeah.
Right, in non-aquatic areas. We do think that as it gets to be the hotter months of the summer, heat index well over 100, 115 degrees, it's going to become very difficult for people to breathe in the mask. We anticipate it being an issue, although we will do our best to enforce it. All staff would wear masks unless actively lifeguarding a zone of responsibility. Lifeguard chairs on station be marked with the 6 feet of distance. Staff will be provided masks. Leadership staff would actively enforce mask requirement and remove patrons for non-compliance. The number of staff required to operate a given feature or a program will not change. Next slide, Jacob, sorry. Number of staff would be slightly reduced to fit the modified schedule, offering water walking with the modified schedule and swim lessons with a reduced class size. Now here's the thing that I do want you guys to pay attention to. Our plan, because of the reduced availability of the pools, in other words, because we're breaking into sessions, we would propose reducing the day pass fee to $3 per person for the ease of contactless online transactions. If you want us to charge the full rate, we can certainly do that, but given that they're only there for 3 hours instead of all day like normal, we don't believe that charging more than $3 is adequate. Groups of 10 passes would be pre-sold using our online registration system. Season pass memberships would always be given first admittance. Pass would load onto a key tag to use to enter the water park, which are scanned upon entry. And occupancy will be monitored by software, which counts all patrons entering the park to ensure compliance. On the next slide, Jeff was able to talk to two of the other, some of our neighbors about kind of what they did in 2020 and what they're planning on doing for 2021. As you can see, in 2020, McPherson did sessions, reduced occupancy, started at 160, ended at 320. After they closed for the midday, patronage reduced significantly for the afternoon session. For the 2021 season, they're not going to do any sessions. They're going to offer a 30-minute break in between for cleaning and disinfection, but no reduction in their max occupancy. And then Hutch, they are going to reduce occupancy. They are going to have mask guidelines. They averaged 762 patrons a day last year. As you can see, their most controversial item was not allowing guests to move chairs. They kept them strictly in pairs of 2. We do have guests that move chairs all over our water park, so that is something that we will also try to enforce if we need to, but it's exceedingly difficult. And then for 2021, it depends on their county's upcoming decision. There are expectations of mask wearing and social distancing. And then they had 3 staff quarantined due to exposure outside the facility for COVID last year. Our morning operation plans, we would continue to offer morning water walking, lap swim, and swim lessons between 9 a.m. and 10:30 a.m. Learn to swim is Monday through Thursday, 3 sessions offered throughout the summer. Water walking would be Monday through Friday. Lifeguard staff would still watch over swim lesson participants and water walking participants, as is our norm. And these are our traditional staffing levels for morning and evening programming. It's not a modification to our staffing plan. If we're open, we still need to have the guards in place to watch the water for safety. The early afternoons operations plan, from 12 to 3, we would have the slides available, the lazy river wave pool, the lily pad walk, the river slide. The lap pool, kiddie pool, and kiddie slide would be unavailable through this model. Late afternoon operations would be 4 to 7 p.m. The lap pool, lazy river wave pool, kiddie slide would be available. The large slides, the lily pad walk, and the river slide would be unavailable with this staffing model. Evening operations plan. Water walking, swim lessons from 7:15 to 8:15 p.m. Water walking continues to be, learn to swim is Monday through Thursday, water walking Monday through Friday. And then the next slide is our learn to swim and water walking.
Question,
Yes, sir.
the operating plan for the different amenities being open in the first session versus the second, is that because of staffing, or what's the reason for that?
Staffing, yes, sir.
So just to follow up on that, on Commissioner Hoppeck's question, during normal times when we haven't broken it into sessions, are all those amenities open at the same time and available for patrons?
Yes, ma'am, with the exception of the lap pool, which, as I mentioned earlier, we've had to close because of low staffing numbers. But yes, ma'am, traditionally everything, in a perfect world, everything would be open all the time.
Okay, and so the reason that all the amenities not be open during both sessions is because we don't have enough lifeguard staff? Is that,
Staffing concerns and trying to keep things clean and picked up.
As well as occupancy limitations.
Right, we're only allowing 600 people in the facility at a time.
So Chris or Jeff are welcome to correct me if I'm wrong, but this model was prepared in anticipation of still being under a mass gathering health order with occupancy limits. It's not driven by staffing concerns, it's driven by occupancy limit concerns and how we come up with some modified operation on the assumption that we're still under a health order. Now that very well could not be the case, or it could be a changed scenario by the time that we get there. But we were getting enough inquiries about whether we had a plan for the pool and whether the pool was going to open this summer that we felt like we need to, number one, advertise for lifeguards, but then also share with you kind of the thought process given what we know at the present time.
Do we have an alternative plan? Because I would expect the mass gathering to be significantly different at the end of May than it is now.
Right. If the mass gathering limits are, relaxed, I think we've got an opportunity to try to transition to something
Do
that
we
feels
have the
more
staff
normal.
are we staffing enough to do that anticipation of the mass gathering?
We are trying to recruit our normal staffing levels. If our preference obviously would be to run the water park as we've always run it and as it should be run. Like Mike said, this is just a hybrid model so that we can actually open this year. If the mass gathering limits go away, then we would be prepared to run at whatever direction we're given, but we would like to run it as normally as possible.
Could I go back then to Commissioner Hoppick's question? Is this plan based on staffing or mass limitation?
Both.
This plan assumes full staffing, but the mass limitation is the limiting factor.
So our full staffing would normally allow us to have all 7 of these amenities open all day?
Yes, sir. Part of this plan would be as, let's say the slide towers are closed and the lap pool is open, then staff that would, for fully staffed, staff that would normally be running those features would also help clean the other features so that we could, sterilize them and clean them because that needs to be done.
So is the only drain on the staff then for the cleaning in between?
From normal staffing, yes, sir.
To keep, that prevents us from having all 7 open all?
Well, but we also have to,
Maybe if the occupancy was not an issue.
if the occupancy was not an issue, if we were allowed to run as normal capacity and full staffing was in effect, then we would run the water park as it should be run. Does that answer your question?
Yes, so now with the occupancy limits and the need to clean, is that much staff time being diverted from managing the amenities and shifted to cleaning that we don't have enough staff left over to, that even if you
Yes,
put the
sir.
hour break in, let's say everybody
I understand.
shuts down for an hour, you can't get in the water, sit in your seat, we have to clean stuff.
If we had our full staffing complement that we're budgeted for, then there's a good chance that we could do both as I think is where you're going. But based on our historical staffing models and what we actually have, in this situation, we don't want to overpromise and underdeliver. So we definitely don't want to run into a situation like we ran into last summer where the lap pool was closed most of the summer because we didn't have the staffing.
I guess I've just got one kind of follow-up question to Commissioner Davis's question, and that would be, is it the best use of lifeguard staff to be working on cleaning and disinfecting? I mean, when I looked at the other operational models that were available here, like with McPherson, they stayed open, but they took a break to do the cleaning, and I'm just thinking it's an awfully hard sell to have half of our features unavailable during a given session. And so I guess my question is, could we not, if the software tracks the number of people that have entered the pool, could we not then cut that off at around 600 and then more people are admitted as guests depart and we some way that, like, okay, the snack bar is going to be on its hourly cleaning session now, make an announcement that the snack bar is not going to be available, do that, and then we could do that through different areas, but you're not closing something down all the way and having it unavailable. I'm just throwing that out because this looks like a really complicated thing to put together.
It is complicated, and Jeff spent a lot of time on this. Obviously, this is just a scenario. We can run the water park any way we're given direction to run it. We just wanted to have an option so that we could open with COVID in place.
Thank
So
you.
is this plan based on 50% occupancy then?
Yes, sir.
I need to ask this next question out of ignorance. Do folks who would tend to use the kiddie pool and kiddie slide not come in the mornings and are more likely to show up from 4 to 7 p.m.? Because I noticed
Usually that's parents bringing their little ones in, so that's just kind of when we broke it down. I mean, people use that feature all day in their traditional model.
Okay, there's one, let me see. I'm just, and again, I'm asking out of ignorance.
Absolutely.
Just things that would not be available from 4 to 7 p.m., the large slides, the river slide. I must admit, I don't remember what the lily pad walk is like, so I don't know whether that's grown up or kids, but.
It's over on the kiddie section. I believe it's 4 or 5 lily pads. It's just like an obstacle course.
Oh,
It has a cargo net over the top, and you go hand by hand over and try to stay on it.
Okay. So I'm just thinking of an older person coming. So the large slides and river slide, those are more older people?
Those are 48 inches and above.
And would those folks be more likely to come when they get out of school or after work from 4 to 7?
We have.
Or- I know,
Honestly, on a given day, we have adults in that age group all day long. So, to answer your question, I think they would come in the mornings, or they'd come when the slides are open, and I think that crowd would dissipate when those features were closed.
Yeah, and
Jeff, I know we had some conversations and you had some personal observations that factored into kind of how this was broken out. Do you have can you shed any additional light on the thinking?
My thinking was that the majority of young people between 6 and 15 were coming in the morning, and the parents were coming in the afternoon with their smaller children. And that's why the kiddie pool was in the afternoon, the kiddie slide was in the afternoon, and the more thrilling features, slides, the river slide were open in the morning, and that's why we kind of laid it out that way. We had considerable discussion about what was the best, and that was the one that worked out the best. Like Chris said previously, ideally we'd have everything available at all times, but if we're trying to make it equally available throughout the day, that was the scenario we came up with that we thought would work the best.
yeah, and I know as a commission, our job's not to manage, it's to govern, but I have a hard time seeing those large slides sitting there from 4 to 7 not being used. I mean, that is what you drive by, that's what you see, that's what the older kids want, so.
Don't disagree, sir. Don't disagree.
I would, yeah, I don't know how we do, we'll see where we're at. I think we're going to be in a lot better place at the end of May. So I'm going to hope that that's open all day. That would be my preference.
Do want to point out that given this model, we do forecast a pretty significant financial loss this year. So we anticipate around $230,000 in revenue, but our operating expenses will still be around $425,000 for an estimated loss of around $195,000. So we want everybody to understand that. This is be a hard pill for us to swallow because in the past we've done an excellent job of recovering our direct costs, but this is more, I guess, in line with the model of a traditional swimming pool. So we want that to be up front so everybody's aware of it.
Well, it's
How are we going
it's
to?
hard to put a price on hope and motivation and inspiration, but I think if the community needs a shot in the arm of those tonics, that might be a small price to relatively
with that.
relatively small price
We
to
just
absorb.
wanted you to be aware of it.
Yeah.
And that's why we're bringing it forward, is it's, you know, something the community's been asking about, it's something that you as the governing body have been asking about. We recognize, you know, it does serve a purpose, and we were able to finish 2020 favorably, so we'd have the capacity to operate in this model, but we wanted to have the conversation with you early. It's early enough that there remains uncertainty about where we might be in terms of the health order, and, you know, I'd remain optimistic in general, but felt like we need to have this conversation at this point rather than wait till opening day to be talking about this.
Where does the money come from for the subsidization?
It-
That could come from Parks and Rec general budget, or where does that, what are we taking from in order to fund
It
that?
essentially would
shortfall?
come out of general fund reserves, which we were able to deposit some funds in 2020, given our financial measures through COVID. So we essentially would be spending some of that revenue or that net gain that we realized in 2020. So to recap just a bit, you know, I think we are advertising for lifeguard positions. We're trying to hire at full staffing levels. We remain committed to that. If the opportunity presents itself, our intent would be to open it up and operate it as fully and as normally as possible. The limiting factor, the primary limiting factor that this is intended to address is the health order, which we'll have to monitor that and see how it progresses. And then, you know, we've lived through a number of years with staffing challenges. If we can get to full staffing, that'd be great. If we can't, we'll just have to manage that issue similar to what we've done in years past. But I think the main purpose for this presentation and this update is to give you a sense of how we thought, what we've seen done in other communities and what we thought the approach might be if we are under a occupancy limitation due to the health order.
How much of the business is walk-up business historically? I mean, as opposed to people who bought season pass, I mean, on any given day.
We actually have,
Oh, Jeff's got
Or to
his
put it
hand
another way, are there 600 season pass folks who are showing up 4 days a week?
Well, while Chris is looking for that information, I know we had a conversation about just this approach being communicated in such a way that people had a sense of a reservation system and they had a time block versus showing up and then finding out that we're at capacity or that they're not able to get in. So part of the value or the rationale behind the reservation process was to kind of clearly communicate in advance that you have a slot or you don't versus just expect people to show up and when we hit the number, we start turning people away.
in
I don't know-
2019, we had 13,002 visits by pass holders, and we had 52,824 for day passes.
And those day passes are almost all but as on a walk-up basis?
Yes, sir. I mean, you can come in, you can buy them separately, but yes, sir, in most cases, they're walk-up traffic, foot traffic.
Okay, I think the mayor's trying to say something here. We're still having audio issues in this side of the
I
stream.
gotcha. I don't know if you can hear me, but.
We can hear you now. Go ahead.
Okay, great. Well, I wanted to recognize Mr. Hammond because he had his hand raised, but it sounds like Mr. Cotton got you that information. I did notice in the presentation that it said that people who had bought season passes would always be accommodated. And I guess I was just a little confused about how that's going to happen if we are operating at full capacity and someone with a season pass, wants to join, but that puts us up at whatever 601 or 610 or whatever their party would be. Have we thought about, how that would work? Or did I misunderstand that whole thing completely?
No, and I think it would go back to kind of what we talked about earlier. It'd be as people left, and then they would be at the front of the list to come in as the pass holder.
Okay, gotcha. And Mr. Scragg, our current mass gathering restrictions, those expire on the 21st, is that correct?
Yes, that's correct. The current restriction is 50% capacity, and they expire on the 21st, and Jason Tiller, the health executive, will be at our meeting today to talk about what the future might hold.
Okay, thank you. Is there anyone else who would, that has questions? I don't see any members of the public on the Zoom end, but if there are any members of the public that have questions that are in room 107, I invite you to ask those.
We do have some general public, but no one seems to be making a move to the podium. So I don't think we have any public comment on this end.
Okay, great. Well, thank you very much, Chris and Jeff. I hope you get to feeling better. I'm sorry that you couldn't be there in person, but thank you very much for checking in, and thanks for getting the technical glitches fixed. And we will meet back here at 4 o'clock unless there's anything else that we have to cover.
Mayor Hodges and Commissioner Ryan, you might want to stay on the line if we need to do any technical troubleshooting between
Sure.
now and 4, please.
Absolutely, will do.
Thank you.
Thank you.
We're safe to stay with.
Hi there, can you hear me?
We
Yes,
can't hear
we
you.
can.
I can hear you, can you hear me?
Yes.
Yes.
Okay, awesome. All right. Do we have Commissioner Ryan with us, either in person or virtually?
Yes, I'm here. I'm
Okay.
in person.
Great, thank you very much. Well, if we're all assembled and present, I would like to call the March 15th, 2021 Salina City Commission meeting to order and begin by requesting that staff confirm that the Kansas Open Meeting Act required notice has been properly provided.
Yes.
Thank you very much. We'll proceed with roll call, please.
Mayor Hodges,
Here.
Commissioner Davis,
Here.
Commissioner France,
Here.
Commissioner Hoppick,
Here?
Commissioner Ryan.
Here.
Thank you. Would those who are please in attendance in room 107, would you please rise if you're able and lead us in the Pledge of Allegiance, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We don't have any awards and proclamations today, which will bring us to Citizens Forum. This is an opportunity for any citizen to bring your questions or concerns to the City Commission. If you do choose to speak either in person or virtually, please give your name, where you're from, and limit your comments to 5 minutes.
Deborah Corrales. What I have given you today is a reminder of the genetic study presentation I gave some time ago. Pictures of 7 dogs and an article labeled, "What's in a Label?" It's an article about Orange County Animal Services in Florida. In 2014, they took a different approach by removing breed descriptions from kennel cards and websites. They process nearly 8,000 dogs, stray dogs per year, so they do not know the lineage of these dogs. What happened when they did this, the adoptions went up, hitting a 3-month record high in 2014.
Ms. Corrales, could you pull the mic down a little bit? They're having a hard time hearing you online.
They mention the article about the genetic study saying that the Basenji Cocker Spaniel puppies today could be misidentified as lab, pit bull type to border collie, beagle mixes. Such a wide variety from 2 purebred dogs. It is time for Celina to catch up with the times. BSL is ineffective. Visual identification is wrong up to 85% of the time. Aggression is not breed selective, and you cannot determine aggressive dogs by the way they look. Only 1% of a dog's DNA determines what they look like. We should go to a breed-neutral dangerous dog ordinance, which is already on file with the city. And the pictures of these dogs are from the Wichita Animal Shelter. They, too, have taken off breed description because they can't tell what they are. So I ask the city to come forward and get with the times and update the ordinance that breed-specific legislation no longer rules in Salina, Kansas.
Thank you, Ms. Corrales. Is there anyone else who'd like to speak?
Dalton, City of Salina. Mayor
Go, Miguel.
Mayor Hodges, you have 4 commissioners here, and why aren't I assume you're here on Skype, but why aren't you here with your commissioners if they're doing it? What's the use of using Skype if there's 4 of them here already? I just think it's time that you stop with the COVID-19 nonsense. It's on the back burner. It's still current, but it's way out there. Our rates are low. I was told yesterday by a member of Salina Regional Health Center that they have less than 10 people. I don't know I can't remember the exact number, but I think this is getting to the point. It is stupid.
Thank you, Mr. McDowell. Is there anyone else who would like to speak?
Hello, can you hear me? Good
Yes.
afternoon. Tyler Sartain, Salina, Kansas. Again, with the BSL, I know it's a topic to a lot of Salinans' hearts that can't be here today, so I'm going to be speaking on behalf of those that can't be here. Over the last few years, this body has been given probably quite a bit of resources that could fill a filing cabinet or two on why we should repeal BSL. Unfortunately, all the work, scientific studies, and conversations that we have only sparked that, conversations. And those are good, but we got to have a little action with that. So we're asking that you please look at this BSL and repeal it. BSL is a false sense of security. It doesn't fully protect Salina's citizens. I mean, there are other dogs that can do damage and kill, even if they are smaller than the average pit bull, or, I mean, whatever type of dog. That's the thing. They can do damage. I don't know if you heard the story recently. 2 German Shepherds were removed from the White House after they bit staffers, and those were the president's dogs. You would think that these dogs would be trained because, again, they are in the spotlight, which is great to have dogs in the White House. But, again, they're dogs. We don't know how they would react. If you're scared, you may act in aggression. If you don't know somebody, you're going to either fight or fly. So, again, BSL, it doesn't help Celina. It hurts it. So please, end this nonsensical and damaging law. Thank you.
Thank you, Mr. Sartain. And if I could just speak to the breed-specific legislation really quickly here, I appreciate the passion that Ms. Corrales and Mr. Sartain bring, as well as their knowledge. But we did, as a governing body, address this issue. Was that back in the fall of 2019? City Manager Mike Sprague can correct me if I'm wrong.
Head, can you? I think that's correct. It was around that time frame.
Right, and the thing is, if we're going to revisit something like that, an issue like that, you know, that close to having already made a decision not to repeal it back in 2019, something that I've tried to make clear is that is really something that's going to take a majority of the governing body to indicate that they want to do that. And I haven't gotten any message that the other members of the governing body want to return to that issue at this point. So I respect you guys for for sticking with this, but I just, you know, I really don't know how to advise you to proceed, because, like I said, unless several other members of the governing body want to return to this, we've addressed this within the recent past. So just, you know, keep that in mind as you continue to come speak to us.
Mayor Hodges, if it's helpful, another alternative is a petition process, and if following the correct procedure with the correct number of signatures, it can actually be placed on a ballot for the community to vote on. That process is something my office is researching, and we're trying to put together kind of a summary handout, whether it's breed-specific legislation or any other topic, to be helpful to individuals that, you know, want to initiate a change in that way. So I've yet to have an opportunity to speak with Ms. Corrales, but we are working on that and should have something that we could share in the near future.
Thank you, Mr. Sprague. I think that would be so helpful for a whole range of issues, but specifically for breed-specific legislation, because I think we've kind of played out this play as far as we can. And I think going ahead and doing the petition process to get a repeal of BSL on the ballot is probably the best bet at this point. So thank you, Mr. Scragg, for providing that information. Is there anyone else who would like to speak?
Rosemary Mai from Salina, Kansas, and I know Jason Tiller's going to speak today on the mandates coming up on the 21st. I feel that it's about time that we stop these mandates and get back to our normal way of life. After all, we've got illegals coming in by the thousands, and here we're stopping our community, keeping businesses from having capacity, hurting our own businesses when we've got hundreds and thousands of people coming in that could care less whether they're bringing in COVID or what. And it's time that we get rid of these masks, get rid of these mandates, and go back to living like we should be living. And as far as the police still giving citations for mask wearers or unmasked wearers, I think that is totally ridiculous. They have other things to be devoting their time with.
Thank you.
Norman Reynolds, Salina, Kansas. Citizen participation is the cornerstone of democracy. That's on your own city paper. So do we have a democracy or a dictatorship here? A dictatorship is a small group of people who are led by a leader who force their views on the people. We don't have a democracy in this country. We've got dictatorship, maybe a republic. A republic is a small group of people who are to administer, not dictate, not set policy, make policy, but who are to administer the laws that we, the people, voted to be governed by. So I address this commission. Are you a dictatorship?
Thank you, Mr. Mantle. It's good to see you again. Is there anyone else who would like to speak?
That looks like it's it for the room, Mayor Hodges.
Thank you
And
very
there's
much.
nobody from the public online, so we should be good to move forward.
Great. Thank you very much, Mr. Wood. We don't have any public hearings or items scheduled for a certain time, which brings us to our consent agenda.
Item 6.1, approve the minutes of March 8th, 2021.
Do we have a motion to approve the minutes as presented, or would someone like to discuss this?
Mayor, I move we approve the minutes of March 8th, 2021.
Second.
We have a motion and a second to approve the minutes of March 8th, 2021. Could we have a roll call, please?
Commissioner Davis,
Aye.
Commissioner France,
Aye.
Commissioner Hoppick,
Aye.
Commissioner Ryan,
Aye.
Mayor Hodges.
Aye. That motion passes 5-0, which brings us to administration, item 7.1.
Item 7.1, Health Department update.
Good afternoon, Commissioners, Mayor, public.
All right, well, first of all, I want to thank Mr. Tiller for being present at the City Commission meeting today. This was at my request that we received an update for him, and I just want to thank him for all of his hard work. I know he spends a lot of time on the circuit, so to speak, trying to get good, reliable information out there for all Salinans, and I thought it would be a good opportunity for him to share his information in a different venue. And with that, I will turn it over either to Mr. Scragg or Mr. Tiller for any further introduction.
I don't have a whole lot. I'll quickly turn it over to Mr. Tiller. As part of the staff report, I tried to provide you a little bit of background, acknowledging that there's currently a health order in effect through Sunday at 11:59. I did attach to the staff report the copy of that health order, which is a mass gathering limitation as well as occupancy limitations. Also provided you a copy of the city's face mask order and the county's face mask order, And then lastly, a VaxFax, which is a regular communication that the health department puts out that spoke a little bit to the target goal of vaccination levels. I think Mr. Tiller is prepared to speak to that in greater detail. I do have weekly update information if that's of interest. At any point, just let me know, but I have that information if you'd like. With that, Mr. Tiller and I have spoken to give him a sense of kind of what we're inviting him to do and what questions you might have, and I'll be happy to turn it over to him.
Thank you, Mike. And speaking of that update, I'm just going to go ahead and cover our numbers real quick for the commission as far as where we are. Total cases, 6,017. Recovered 5,745, which is always good. Active cases right now being followed, 165. Deaths remain at 107. And hospital currently has 3 COVID patients. To put a little perspective on that, the 2-week number that I usually put together for the county commission reflects the difference between the number of cases we had during the last update till this point, which I am happy to say is only 66 new cases in the last 2 weeks. You know, there was a time about a month and a half, 2 months ago where 66 might be a single daily, you know, rate of cases. So we have made a significant amount of progress. Because of that, and because of the continued increase in vaccinations, which at this point, and I'll get to the orders in just a minute, but I want to speak a minute too on vaccinations, that by the end of this week, we expect to have 11,000 people who live and work in Saline County vaccinated. The rate, I believe, of vaccinations are probably going to start ramping up very quickly in the next few weeks. One additional announcement that the governor has already probably put out at her 4 o'clock special announcement today, or will very shortly, is that on March 22nd, the state of Kansas will be moving to phases 3 and 4, which means that we will be able to start vaccinating more people at a much faster rate and be able to get back toward, or at least closer in that direction toward normal that everybody is looking for. With the decrease in cases, the decrease in hospitalizations, the decrease in deaths, and the significant increase in our vaccination rate, I am pleased to say that with those indicators that I intend to let the public health mass gathering order expire on March 21st at 11:59, which will then allow gatherings to continue to take place. We do urge that people continue to, while we're still getting everyone vaccinated, to exercise caution, social gathering, especially with people they don't know, and continue to wear the mask. Which then brings me to the mask update, which of course is the city's and thus for the county's ordinances respectively. I think that to remove those mask mandates at this time, especially if we're going to let the mass gathering order expire, is a bit premature. We have looked at some indicators to try and be able to make a safe transition. And again, these are just recommendations, but one of those is that we target or try to get to a 70% of the adult population in Saline County vaccinated. And with the increase in vaccination and being able to hit those phase 3 and 4 folks, I think we'll be able to get there much sooner. Additionally, I think it would be also helpful that we are seeing, or that we need to see days without cases. Even though our numbers are much lower, which is very, very good, we are still seeing cases daily. And then I think that would put us in a much better position if the city and therefore the county as well were to remove or reduce any type of mask order. Again, that is only my recommendation when it comes to the mask order. At this time, barring that, are there particular questions that I can try and answer while I am here? Yes, sir.
Yep. Just for those on Zoom, Commissioner Davis. So your order, if I'm understanding, wouldn't necessarily be an order. You would just let the mass gathering limitations expire?
Correct. We wouldn't need to do a rescinding of it or anything like that. It's already set, it has an expiration date of 11:59 PM on the 21st, and then we would just let that expire.
Okay, and what does that do for social distancing?
So the order itself in particular has stipulations in there for social distancing. Then what would happen is that social distancing would become a recommendation, but not necessarily a requirement in those venues.
I guess that's where I have my problem. This is serious enough that I think people need absolute direction, and it needs to be uniform. You know, and I have not heard any doomsday predictions for folks traveling coming out of spring break, but it's probably about the worst week of the year to, in my opinion, to get too callous and get too smug.
And oh, excuse me, sir.
Yeah, no, and I would much rather see clear-cut directions for businesses and other institutions on the social distancing. Now, I know folks are tired of wearing the mask, but that normal you used to know, it ain't coming back anytime soon. And you're sitting here, a lot of people were sitting here like you 6 months ago, feeling fine, and they're in the grave right now. And, the ozone layer was going away. It's gotten better, but we haven't stopped, prohibiting, the fluorocarbons that depleted. Just because we're getting better doesn't mean we're past the gate and this is over with. And I think we've seen what happens when you leave things up to people's wherewithal to make their own decision. Biggest example being the state of Texas. So I'd just like a little more direction in the form of social distancing. That was it.
Okay, sir.
Mr. Tiller, I would like to, first of all, I'm going to pat you on the back a little bit. I was fortunate enough to get in on the first round of vaccinations and it was, 6 weeks ago or something like that. And I must say I was impressed with the way your staff and the medical staff handled themselves. You did a very good job of processing people and getting us in and out. And then when I went back for the second shot, it was even better. I think it took us about 30 minutes total, all waiting time, including the waiting time to get out. So I was very impressed with the way your people handled that. Obviously, that took some thought and some organizational skills, and I do appreciate that very much. You mentioned a 2-week number, and on about July 8th, when we implemented the mask mandate, that number stood at about 118. It got as low as 47 in August, and then it started moving back up. And as of last Friday, I had it at 74. You've got it today at 66. That's good. So if you look at the active cases, July 8th, they were 173. As of Friday, they were 185. Now you say 165. And in my view, that active case number is what reflects kind of the reservoir of the virus in the community that is communicable. That is, it's a kind of a risk factor assessment. So I think we're making progress. We may be getting close, but I'm not quite ready yet to pull the trigger on going from a mandate to an advisory for the masking. I think we need to see where this thing goes. If you look at the daily rates, they dropped very dramatically until about February 17th, and then there's a decided flattening in that drop. So we may be, if it stays flat, that's wonderful. If it continues to decline slightly, that's good. But we may just be in a valley, and there may be another hill peak coming. We don't know exactly what drives this thing in total. So I'm unwilling, along with Dr. Davis, to go so far as to repeal the mask mandate at this point. Mass gathering order I have less concern with, but I think it's something we definitely need to keep an eye on and be ready to pull that trigger and move from a mandate to an advisory, hopefully in the not too distant future.
And I agree with that, sir.
Couple questions, and this one may be to the city manager. With the mass gathering expiring on May 21st, how does that affect the conversation we just had about the water park?
And significantly. I think that becomes more of a policy decision for us and what our level of comfort is, but in conjunction with, what's in place, we could go back to full capacity. The social distancing being recommended while not required, whether that's the Kenwood Cove or the Field House or Tony's Pizza Event Center, becomes an administrative question we'll have to address. But we would be back to full capacity if we so chose.
Okay. I think that's something we need to discuss as a group then, if we're talking about the mass gatherings, and also how if we're going to have any kind of social distancing requirements. A couple questions. I know that you had talked about looking to maybe do away with the mask mandate when we reach 70% vaccination in the community. Are we able to track the number of individuals that are actually getting vaccinated outside the county? I know there's numerous people that have gone outside the county.
Right, but on the same token, we've also had numerous people who work here that live outside of the county who have gotten vaccinated.
Right.
So as of this moment, we are tracking the total vaccinations we are giving. The state system that this information is reporting into is not user-friendly at getting that information back out of, for us as a usable level of information at this point. They've rolled out something new on their dashboard, but I don't have full confidence yet in that information and what that information actually means as a rate of vaccination that they have put on there. So yes, we are tracking, and also knowing that trade-off, if somebody goes to another county, we've likely got somebody that works here that we have vaccinated overall.
When you talk about vaccinating the adult community, what ages are you looking at?
Right, so the Pfizer vaccine is for 16 and older. Moderna and Johnson & Johnson both are for 18 and over. And when we're talking about the adult community, we're talking about those 18 and over. Primarily too, because the majority of what we have gotten has been Moderna and the Johnson & Johnson. And so also looking at the census numbers too is how we kind of started off with approximate number of people in the county that were over the age of 18, and then working with that number plus the number that we have vaccinated to look at the percentage of adults that we have vaccinated in the county.
I guess, and this is just my opinion, but I really don't think we will reach the 70% as a community.
Again, it's a target for us to reach to. There's also a point that I think that we may come to where we have satisfied the demand. Right. And that will be another conversation of if everybody that wants to get vaccinated has gotten vaccinated and we may not be at 70%, then we also have that conversation then too.
Right.
But 70% is a target for us to work towards, not a concrete number that we absolutely have to get.
That's kind of the answer I was hoping to hear. Yep. So, okay, thank you.
One other question. You probably read the article in the paper this morning about the racial and ethnic disparities and the percentages people being vaccinated. Is the data that Saline County updates include ethnic background?
It does. When we are registering individuals, and then also on the consent form, it has that information on there. And so we are also, all of that information is inputted into WebIZ when we give the vaccinations. Unfortunately, again, it's not easy for us to pull back out at the county level, but we are also, part of our planning and our team also includes folks from Celina Family, Celina Regional, and so as we are looking at those types of of issues, those disparity issues, those who have not, who may not be getting the message about how to register for vaccine, and then how do we try to overcome those so that we can get vaccine to everybody in the county.
Or do we have any census tracts or any other geographical markers which identify areas that would appear to be underrepresented in those getting the vaccines?
We originally were trying to look at census tracts, but we haven't really spent much time on the census tracts. Some of that, I feel, has to do with the way the state rolled out the individual phases of who was to be in each phase, for instance. And so that has been probably more of our driving initially about scheduling people to get them vaccinated. I do not remember if it was by census tract or by zip code at trying to look at one set of data, but I think it, for the most part, encompassed the city of Salina, so it didn't really give us much division of where a greater need might be. Now, those conversations, we know that geographically there are other places in the city and in the county that we need to try and get to, and I think that as we get more vaccine, being able to have other clinics in different places besides just at the JCPenney building will be something that we'll be able to accomplish down the road.
All right, so there's no way to, or I shouldn't say no, is there a way to track the numbers of people being vaccinated by the estimates of people living in certain areas? I mean, they're elderly and people probably spread all around town, but any other breakdowns you start?
I don't know off the top of my head how deep we can get into it. Much of the information, too, that we currently have, say, from the registry, once we started that, there was also a significant amount of healthcare workers and nursing home and nursing home workers that were all vaccinated prior to us developing this registry and being able to collect some of that information. And with the federal vaccination program and long-term care that was also going on in the beginning of December, much of that information about how many were vaccinated only came from us making those phone calls. That wasn't reported to locals because it was a federal program.
Okay, so let's say 2 months down the road, how would you determine if certain neighborhoods were vastly under-vaccinated by your best estimates of the population and by the people who'd shown up?
That's a good question, sir. We're still working on how to be able to identify that and follow up on that. And I'm sorry that I don't have a great answer on that right now.
As long as I can plant a seed, or maybe you've already thought of it, obviously, that's good. Thank you.
Yes, sir.
I had one more question, and again, there's so many things that float around out there. Does the CDC, did they come out with a recommendation that if there's individuals that have both had 2 shots, that masks are not required?
So what the CDC and consequently the KDHE came out with is that if there are individuals who have been fully vaccinated, and fully vaccinated means that for Pfizer and Moderna, they've had both shots, and it has been 2 weeks since their second shot, or 2 weeks from the 1 shot of Johnson & Johnson, that then they're considered fully vaccinated. They can gather in a private home or small group without masking or social distancing. Furthermore, if it is, say for instance, you, sir, you've got both of your shots, you were going to visit your grandmother who hadn't had hers yet, you could still be able to visit them using some still minor precautions, but because you've been fully vaccinated, that removes some of that. I would still caution, though, that when you're in public, and the guidance goes so far to say, too, that when you're in public, you still need to, of course, follow what the local guidance is, and also that you need to mask in public, because we're just not to the rate yet where we have enough people vaccinated.
Okay. Thank you.
If I might follow up, you'd said 70% is kind of your target. I presume that's based on the World Health Organization position that is the level at which herd immunity is conferred?
So in general, 70–80% is considered herd immunity of a population. For COVID, they don't really know exactly what that percentage is. So we are, we couldn't really say that well, we're just going to go till we get to some percent. So we use that, which is a known number, as a target to work towards for the adult population, which we feel is more attainable, and based off of the number of kids that were that had COVID, and the less likelihood of children to be able to transmit it. We felt like that was a good target number to work towards.
Okay, and that was my point, is that it is not a COVID number, it's other viral transmission, which may or may not be the same.
Right,
Might be less, might be more with COVID.
right.
Okay, thank
It
you.
just gives us a metric to work toward.
Thank you.
I have a question, maybe more for Mr. Schrag, but let me say, Mr. Tiller, that considering where this began and how you had to ramp up completely from the beginning, I think you've handled it very judiciously and very sensibly. So I appreciate all the work that you've done with all the partnerships that you've had to manage both above you and with the different organizations in the community.
Thank you.
Just because I don't know, Mr. Schrag, I was going to ask, it's my understanding the schools will go back full classroom after spring break, is that right? So-
April 1st is my understanding, yes.
And so they'll still be wearing masks, but, and they'll attempt social distancing, or is that
Actually-
still?
Well, so, yeah.
Jason may know the answer more
So
than I do.
I think that we have, in working with our school districts, I think that we have done a phenomenal job in trying to minimize, and with the school nurses, be able to quickly identify when somebody was positive and who might have been exposed, and making sure that they were quarantined. Because we've had very, very low, and I'm sorry I don't have that specific number in front of me, but very low transmission amongst kids who may have been exposed at school. And because of that, school, other than when 305 was doing hybrid in their middle and high school, all the schools have been in session this entire school year. And we have not had to close any of the schools at any time during this school year, which is, I think, a phenomenal step and a nod to them with their attention to detail and their dedication to making sure that things were done right and safely. And the fact that they have continued to do that is also one of the mitigating factors of being able to, come back to full time with everybody in school, middle school and high school in 305, on the 1st of April. So they've been phenomenal partners to work with. And I think that is really important that we recognize, and you mentioned the partnerships, and I just want to give a shout out to the city and to everybody else, but partnerships in this county throughout this have been phenomenal. To work with, we've been able to have meaningful discourse and talk about things without it being a blaming or a unprofessional, conduct amongst partners. So I am very appreciative of the partnership we've been able to have with the city through this as well.
Thank you.
And any other commissioners have questions or comments? I have just a few myself, and just to follow up mostly on questions that have already been asked. So what does the number of 70% of adults 18 and over in Salina or Saline County, what does that number actually look like? You may have referred to it and I may have missed it.
No, I didn't say that number
number we're looking to
specifically,
get
but
to?
it's about, I believe, 28 to 29,000 adults.
Okay. And how many vaccines generally, and I know it varies, but how many vaccines from all sources are generally available each week when you take into account the county health department, private sources like Dillon's or B&K? Do we have any sense on the total number of vaccines that are available for our use every week?
So our estimate would be on an average, probably 9 through 12, maybe about 1,200, between 900 and 1,200 on a given week.
Okay. But we are able to track the private vaccinations, so to speak? I mean, like, say, like a pharmacy or a grocery store will say, you know, we vaccinated 100 people this week, or, but there's some global accounting for the different sources of vaccines?
Yes and no. When it comes down to the pharmacies, because again, it's like the federal program for the long-term care facilities, the pharmacies, it's also a federal program for pharmacies, so that's coming directly from the feds to the pharmacies. They in turn have to put that information into the state's WebIZ system in order to track the vaccines that they have given. However, when that whole process was developed, it wasn't developed with communication with the locals in mind. So we have talked with the regional Dillon's rep, for instance, and trying to figure out how we can get some sort of reporting to get a better idea of how many they're giving. And there's still some hoops, I think, that have to be jumped through or figured out for that one. You would think it would be as simple as them telling us, hey, we gave 200 this week. But I think that there's just either some logistical or issues in there. I'm not exactly sure. But they weren't really forthcoming at first about saying it would be that easy to do.
Gotcha. And then I think it was Commissioner Hoppick had alluded to this earlier, you know, and then, you know, if, say, Dillon's did give 100 vaccinations in a week, how many of those were Saline County residents versus, you know, McPherson County or you know, Dickinson County or whatever. And you said that, you indicated that was pretty difficult, even to track the vaccinations that had been given through the health department. It was pretty hard to get that information backed out of like the state system.
Correct.
I think.
Correct.
Okay.
So one of the thing on the pharmacy vaccinations in response to that too, is that the state of Kansas only has a residency requirement for those who live in Kansas. Each county can either make or not make a county residence requirement. And we chose to, especially early on when vaccine amounts were very sparse, to focus on those who lived and worked. Especially because those who work here generally will spend 40 hours or more working, and then not counting any other time that they spend here shopping, you know, eating, that kind of stuff in the community. The pharmacies, especially the chain pharmacies, don't have that requirement. Their only requirement was to follow the state's phase guidelines, but not any type of residency. So theoretically, anybody for the pharmacy could come from, you know, as far as Ellis or Wilson County to Dillon's here in town, or you know, vice versa. So, but again, I think going back to the overall goal of just getting as many people vaccinated until we either meet the demand or at the rate of production that's starting to ramp up, I don't think we'll run out again, but we definitely want to be able to meet the demand.
Absolutely, and that was good. That perfect lead in to my next question was, what is the biggest barrier in terms of being able to vaccinate more citizens every week? Is it just the vaccination supply? Do we reach a certain threshold with, you know, the number of vaccines that we can give each week or each day in terms of our staffing?
Well, it is overall, it's the supply of how much we get from the state. And that dictates how many vaccines that we're able to do in a given week. And theoretically, well, not theoretically, but even a few weeks ago, initially they were telling us we might get 500 doses a week. And then that has, over the last several weeks, ramped up significantly. But it's still, we have more people on the registry than we have vaccine for, even as we move, you know, through, I think we're ready to do 1,100 this week. So the supply in and of itself still continues to be the major limiting factor.
Gotcha. So if hopefully the supply continues to open up, we'll be able to accommodate that with our infrastructure and be able to ramp up accordingly
Yes, ma'am, I believe
to accommodate more vaccination appointments.
Yes.
Okay, cool. And then, let's see. Sorry, I was making notes while other people were speaking here. So I think that's about all that I have. So we're looking at getting close to 29,000. Our goal is to get about 29,000 citizens vaccinated. We've vaccinated 11,000 so far.
By the
And
end
do
of
you
this
have
week. By the end of this week, we'll have 11,000.
by the end of the week, you'll have 11,000. How many more people remain on the registry?
I think maybe under 1,000 for phase 2. We have some on there that have already registered for phase 3. We
Okay.
had put out in our VaxFax on Thursday for those that qualified for phase 3 to start registering. And now, given the governor's announcement that next Monday the state will move to phase 3 and phase 4, I'm assuming that that number's probably going to go up significant in the next few days of people registering. So I'll have a better idea of what we're looking at in the next few weeks as far as how many people are wanting, first of all, demand, and how long that may take to get them vaccinated.
Gotcha. And just for folks who may be hearing some of this information for the first time or have forgotten about it, people can register at Vaccinate Saline County, Kansas, and that's ks.com.
Correct.
And they can also sign up for news releases on the county's website at saline.org/coronavirus. And that way they'll be in the loop. On Tuesdays and Thursdays, you have vaccination updates, your VaxFax, and then on Monday, Wednesday, Friday, you have the most recent data for COVID statistics.
And if they like to listen to the radio, our media specialist has me doing KSAL on Monday, or excuse me, the first, third, and fourth Thursdays at 8:15, and KINA every Saturday, every other Saturday at 9 a.m. So if they prefer to hear it that way, and they can find, information on one of those. She keeps me busy.
Gotcha. And thanks for doing all of that outreach. If there's one thing that you would want us to know in terms of feedback that you've gotten from community members about the barriers to getting vaccinated, is there any specific resistance that that we can address through education or different kinds of vaccination opportunities?
I think at this point, being on the spot, really just to help amplify the messages that we're getting out there to be able to reach as many as possible. A few times we have done some print ads we have a Spanish language, so for the VaxFax, if somebody needs that one. But that would probably be one of the biggest things right now, is just helping us get the message to everybody through as many means as possible.
Great. Thank you very much, Mr. Tiller. That's all I have. Is there anything else from the commission or staff? And we can open that up to any kind of public question or comment.
Yeah, I just have one last question. I just heard this from a lot of my patients are over 65. But she said that she had placed herself on the registry but had not heard yet. And when you said you thought you were down to 1,100 left in phase 2, if she has not heard, is that usually just because her number is still higher than the number of vaccines, or should she call to make sure that she's still on the list?
So a couple of things there. One of the things is that on day one, when we opened the registry, we had 6,000 over 65 folks that signed up. And when we started dividing up some of our vaccine allotments to do like law enforcement and other phase 2 groups like that, that took us a little bit longer to get through that whole list. That being said, if someone is still wondering or they still haven't gotten contacted, Celina Family Healthcare, is one of our partners, has been managing that list for us. And so if they reach out to Celina Family Healthcare to check on their status on the list, they are happy to be able to double check that, make sure that they are registered, and then they may even be able to give them, they can't tell them specifically that you're going to get a call in 2 or 3 days, but they may be able to at least help with that time frame, that it may be this week or next week.
All right. Thank you.
All right, if there are any members of the public that have a specific question for either Mr. Tiller or the commission or staff, I'd invite you to come forward, give your name, where you're from. However, one disclaimer here, if you want to communicate your opinion on mass gatherings, masks, pros and cons, more general message like that, I'd ask you that you reach out to us through another means, either by email or during Citizens Forum next week. I'd like to keep this focused on specific information that Mr. Tiller can provide to get out, to make sure that accurate information is getting disseminated. Is there anyone who would like that has questions or would like to speak to that?
We don't see any in the room, Mayor Hodges.
All right. Thank you very much, Jacob. And thank you, Mr. Tiller, for making yourself available today. And thank you to Salina Regional Health Center, Salina Family Healthcare, USD 305 city staff, and all who have come together to address COVID in the community. Thank you.
Thank you, Joyce.
All right. That brings us to item 7.2.
Item 7.2, consider awarding the bid for project number 21021 to resurface the flooring and walls of the lazy river at Kenwood Cove Aquatic.
And do we have Mr. Cotton or Mr. Hammond available?
Yes, ma'am.
All righty, go ahead.
Good afternoon, Mayor Hodges and members of the commission. Chris Cotton, Parks and Recreation Director. I'm coming before you today for your consideration to replace the finished concrete coating on a portion of the lazy river walls and floors at Kenwood Cove. Last fall, we did a full inspection, tested the pumps and motors of the facility. We identified that the finished concrete surface of the lazy river needed to be addressed before the 2021 opening due to excessive spider cracking and delamination that you can see in the photos in your packet. The most likely cause of the spider cracks and delamination is the heavy use the river receives through the summer and the freeze-thaw cycle through the winter. The total square footage that needs to be replaced is 12,500 square feet. You can see the overview of the proposed affected area from the graphic in your packet. The area represents over 1/3 of the total wall and floor finished concrete of the entire facility. The current finished concrete surface is called Diamond Bright, which was installed in 2010 when Kenwood Cove opened. Diamond Bright is a Portland cement with quartz aggregate mixed in. Diamond Bright has a very good reputation within the commercial pool industry. It is a very popular way to finish a pool surface. It is durable, easily maintained, and an affordable choice to finish our pool wall and floor surface. It has a textured surface consisting of small pebbles in the cement being brought to the surface. The life expectancy on average is approximately 8 to 12 years. This will be the 11th year of operation for Kenwood Cove. When researching for companies within the region that would be available to do this work, staff reached out to Sunflower Pools, Pools Plus, Westport Pools, Coat Your Pool, and Mid-America Pool Renovation. The request for proposals was advertised on January 17th of 2021. As you can see from the blue sheet, we only received one bid for Mid-America Pool Renovation located in Grandview, Missouri. The amount is for $151,815. The bid came back higher than budgeted by $6,815 due to additional square footage the contractor identified as necessary after walking the area. Additionally, they would include a tiled caulk joint in the lazy river area that goes through the wave pool to assist in preventing future hairline cracks. They felt these items necessary to ensure they could stand behind the 5-year warranty. Speaking with Westport Pools recently, that company stated their calendar for spring has been filled since October of 2020. They further stated that many of the smaller companies that do pool resurfacing work went out of business in the past year. Coat Your Pool does not provide concrete finished products. They provide fiberglass resin finishes. And speaking to the owner of Sunflower Pools, they no longer had employees to provide such work. The Kenwood Cove Maintenance Fund balance as of December 31st, 2020 was $192,389, which would adequately cover the amount of the bid. the project is approved to move forward, there would be a remaining fund balance of $40,574. Additionally, we would have the 2021 funds for maintenance of Kenwood Cove for necessary repairs to buildings and equipment, staff, and equipment. Staff has identified the following options for City Commission's consideration. We would ask you to approve a motion awarding the bid for project number 21021 to Mid-American Pool Renovation in the amount of $151,815 and authorizing the city manager to execute a contract with Mid-American Pool Renovation upon fulfillment of all prerequisites under the bid documents. Staff will stand for questions.
Thank you. Any questions from the commission?
So there is no contingency on a project like this?
That is their, well, that's their amount that they'll do it for, and that's the price we'll hold them to.
And kind of an ancillary question, this, we've been setting aside, it says here, $68,350 per year for some time. That was based on a calculation, an estimate that was done, I don't know, 2012, 2013, I don't remember exactly when, by the Parks and Rec Department. Has that number been revisited in light of our experience? And the reason I ask the question is you say we're going to be resurfacing about a third of the area after 11 years, and the anticipated life is 10 to 12 years. That sounds to me very much like the remaining two-thirds are going to have to be done relatively quickly, and that will obviously deplete that set-aside fund. So I'm just asking the question if maybe we shouldn't proceed to try to update that set-aside calculation given our experience to date.
We can absolutely look at that. However, I'd also want to say that we have inspected the rest of the Diamond Bar surface, and at this time, it is in good condition.
Okay.
The area that needs to be replaced is the most frequented area. It has what I would consider to be a massive amount of foot traffic on it every day that we're open. And so I would say due to the wear pattern, that's just one of the reasons that area is finally needing attention. But
Yeah.
I want to let you know that staff does an exceptionally well job of maintenance on that facility. And I couldn't be more pleased with Jeff and his efforts to maintain Kenwood Cove.
And I'm not being critical of that. I'm just saying that we've now got 10 years of experience with operation. Maybe that set-aside number should be revisited as a part of our next CIP process and updated to maybe something that is more up-to-date, I guess.
Yes, sir.
Yeah, Commissioner Franz, your point's not lost. It seems like everything as it relates to the water park is a big ticket item. And so we sweat that fund balance and what our maintenance might be going forward. In the event that we have something that comes up that exceeds the fund balance, we'll be forced to find an alternate way to pay for it. If we can alter that number and set aside a little bit more, that certainly would help us be prepared.
Is there anyone, I had the same concern as Commissioner France. That was the only thing I had written down for this. Is there anyone else that has a question? If not, we'll open it up for public comment. If there's any member of the public that has a question about the project or a comment.
I see none in the room, Mayor Hodges.
Thank you. With that, I'll bring it back to the commission for further discussion or action.
This Mayor or Commissioner Hoppick, I move that we approve a motion awarding the bid for project number 21021 to Mid-America Pool Renovation, Inc. in the amount of $151,815 and authorizing the city manager to execute a contract with Mid-America Pool Renovation, Inc. upon fulfillment of all prerequisites under the bid documents.
Commissioner Davis, second.
We have a motion and a second to award the bid for project number 21021 to resurface the flooring in the walls of the Lazy River at Kenwood Park to Mid-America Pool Renovation Incorporated. Could we have a roll call, please?
Commissioner Davis.
Aye.
Commissioner Franz.
Aye.
Commissioner Hoppick.
Aye.
Commissioner Ryan.
Aye.
Mayor Hodges.
Aye. Thank you. That motion passes 5-0, which brings us to items 7.3A, B, and C in our newly numbered agenda.
Item 7.3, general obligation bonds and temporary notes. Item 7.3A, Resolution Number 21-7941, authorizing the offering for public sale of general obligation temporary notes and bonds. Item 7.3B, first reading of ordinance number 21-11055, authorizing the issuance and delivery of approximately $8,145,000 principal amount of general obligation internal improvement bonds. Item 7.3, authorizing the city manager to enter into an agreement with Steeple, Nichols and Company Incorporated to provide financial advisor services for the city of Salina for the issuance of the 2021 general obligation temporary notes and bonds.
Thank you. Ms. Pack?
Good afternoon, Debbie Pack, Director of Finance and Administration. Good afternoon, Mayor and Commissioners. This item is part of our annual issuance of debt financing for the city of Salina. There's two items involved here with the actual debt financing itself. That's the Resolution 217941, which basically authorizes us to go out for public sale for our notes and bonds. It also provides us for the authorization to provide the documentation that's required for those notes and bonds, especially the official statement, which describes kind of what we're selling and who we are, so that investors can make a good decision based on that information. The second part of the financing is for the bonds. In order to issue bonds, the city must issue an ordinance. So Ordinance 21-11055, to be considered today on first reading, would authorize the issuance and delivery of the general obligation bonds. The second reading of that ordinance is scheduled for April 12th, which is the day that we'll accept bids, and we'll also bring those bid results forward to you on that day. The temporary notes are being issued as temporary partial financing for the 9th Street Bridge, the river renewal final design, automated sanitation trucks, and the HVAC at TPEC. The bonds are being issued as permanent financing for the basketball floors at TPEC, the police training facility, and 3 special assessment districts at Stone Lake 2, Pheasant Ridge 3 Phase 2, and 9 South. I provided a lot of information to you just as background, but I'm not going to go through that information unless you have specific questions. The final piece of this action item is a financial advisory services agreement. Per the Municipal Securities Rulemaking Board, financial advisors are now required to have an agreement with the municipalities that they are serving for each of the issuances that they have. Steeple Nichols, who was previously George K. Baum, has been providing financial services to the city for many, many years under Roger Edker and Dave Arterberry. Roger recently retired when Steeple Nichols took over in 2019. So we still have Dave Arterberry as our main financial advisor, and I believe he's on the phone if we have any questions for him. The agreement that we'll sign with him basically states what their fees are going to be and what the services are that they're going to provide, which include analysis of the issuance. They issue the official statement. They coordinate with Moody's and any of those rating companies. They provide calendars. They do a lot of work on the issuance for us. I did provide a draft, and like I said, Mr. Arterberry is on the phone if you have any questions in regards to that. As far as the fiscal note for this, in 2020, the effect on property taxes is about $414,500, and special assessments is $161,875. There are 3 separate action items. We've provided 4 options for each item. You may approve the item with amendments as you deem appropriate, postpone consideration of each item, or vote to deny the item. And staff is recommending option 1 for all 3 of those items. As I mentioned, I do have Dave Arterberry on the phone, and I believe also we have members from Gilmore and Bell who are bond counsel on the phone if you'd have any questions for them. I'd stand for questions.
Any questions from the commission? I guess I've got one in terms of our future debt payment estimates, and I know we've talked about this in the past about how we have a pretty high debt payment amount in 2023 and to a lesser degree in 2024 and 2025. Are we pretty much maxed out on our capacity for debt payments in 2023?
No. The number that I provided you for the debt finance payments was the number, that $3.3 million was the number
Okay.
that we estimated would need to come from property tax.
Okay.
There are some other taxes that are included in those payments that we only estimate. So if we have transient guest tax, motor vehicle tax, delinquent property tax, and other tax, and transient guest tax, because we don't know what those numbers are going to be, they're estimates at this point, that number could go up or down, depending on what that number does. And what we do is, as we go through the budget process in the fall, we look at what the property valuation is for that particular year and determine what the necessity is for that number. And as we get closer to that 2023 date, we'll have a better idea of what those numbers are going to look like.
You might also
Does that
touch
answer
on,
the question?
Yeah, I think so. I was just looking at, and please understand, even though I've been doing this for a few years, I still don't have the slightest idea about municipal finance. I was just looking at page 3 when, where you have the table with the total debt payments. And when we get up there to like 14.2 in 2023 and then 13.8 and 13.4 in 2024 and 2025, those numbers just, they caught my eye.
Yeah, and I will say too that, I lost my train of thought, go ahead.
I was just going to add another variable is the debt service fund balance and what balance there may be and what availability there may be to apply some of that to some of those years of debt service where it's getting higher.
I've thought about what I was going to say now. I think your question goes back to what is our legal debt margin? What is that percentage that we look at each year? Off the top of my head, and I don't remember as well these days as I used to, I want to say we're in the 40% range of that number. We do calculate that each year as we do the annual audit to make sure that that number is at a reasonable amount. So I believe last year's number was in the 40% range.
Okay.
So when you ask about our capacity, we're about 60% or so lower than what our capacity would be.
Great. So
Based on
as long as we can make our payments, I'm happy.
Yes.
Okay, thank you. Are there any other questions from the commission?
I would suggest that number on it's, I guess, page 3. If you go to page 4, it talks about the property tax required, and that also shows somewhat of an increase for those years, but it's considerably less than the number on page 3 because that page 3 number includes all of the enterprise funds.
That's correct. And
So
as you recall, we're adding our water treatment plant and we'll be adding our wastewater treatment plant right about that time. That debt service will be kicking in for those two plants.
And I guess my question on page 4 is that current property tax projection, does that include applying any fund balances we might be carrying? Because I know that was a little bit higher than anticipated. So that should work to moderate that number to some degree?
It does not include using that number at
Okay,
all, so you
okay.
are correct. We
So
could modify
in
that.
theory anyway, that number might be moderated by allowing that fund balance to move down towards target instead of levying additional taxes. Okay,
Correct.
thank you.
Correct.
And part of the reason we provided this information is to have this conversation. It doesn't necessarily impact this bond issuance. In fact, and these commitments are made, but it does make the point that we've got some debt management to do between now and 2023 in particular.
And I would also like to say this isn't a surprise. This has been a part of the capital improvements program and the debt projections related to that for some time. It's very difficult to organize these projects in a way to maintain a perfectly smooth line. It just doesn't work that way.
Right.
And so there are ups and downs to be
And one of the
considered.
reasons we wanted to provide the kind of list of projects that we're financing at the time is so that you can see that there are some large projects in there that we have done in the recent years that, we may not have those coming back. We may have others as we think forward. but just to kind of see where those dollars kind of lie for those specific types of projects that we've been issuing debt for.
And one of the things we did was we moved the police training facility to property tax out of that sales tax too, which
That's
bumps
correct.
this about 400,000, so,
That's correct.
yeah.
And even so, the debt service millage continues to hang between 6 and 7 mils over the, the past 10 years.
Yes. And I do
Any other
have Dave
questions from the
Marbury on the phone. I don't know if he wanted to make any comments or not.
Mr. Arterberry, did you want to make any comments, or are we good?
No, I think the only thing that I would like to add, if it's all right, is that we do have a call scheduled with Moody's Investors Service for next week to review the city's rating. And we're going to have on Wednesday a sort of a prep call just to prepare us for the following week's discussion. But other than that, that was really all I just wanted to add.
Great, thank you. Thank you.
Commissioner Hoppick here. I just had a quick question. Are we starting to see a little uptick in the rates that we expect those bonds to come in at, or?
Yeah, that is a good question. Interest rates from about August of 2020 until the middle of February this year were at historic lows. They were just incredibly low rates. In about the middle of February and lasting until right about the end of February, municipal bond rates jumped up. They jumped up about 0.4 of a percentage point or so. So they're still, if you look at from a historical perspective, still very low. They just aren't as low now as they were back, in August through February. Since the end of February, the rates have actually come down a little bit. Right now, they're probably about 0.3% above those early February lows. So bump up a little bit, but still on a historical basis, very, very low.
Any other questions for Mr. Arterberry or Ms. Pack? We'll open it up for any public questions or comments.
There are none in the room, Mayor Hodges.
Imagine that. Nobody wants to talk about bonds. All right, well, then I'll bring it back to the commission for further discussion or action. And we do have, as Ms. Pack mentioned, we have the 3 separate action items.
This is Commissioner Hoppick. Mayor Hodges, I move we approve resolution number 21-7941, authorize the offering for public sale of general obligation temporary notes and bonds.
Commissioner Franz, second.
We have a motion and a second to approve resolution number 21-7941, authorizing for public sale of general obligation temporary notes and bonds. Could we have a roll call, please?
Commissioner Davis.
Aye.
Commissioner Franz.
Aye.
Commissioner Hoppick.
Aye.
Commissioner Ryan.
Aye.
Mayor Hodges.
Aye. That motion passes 5-0, which brings us to ordinance number 21-11055.
Commissioner Franz, I would move that we adopt on first reading ordinance number 21-11055, authorizing issuance of general obligation bonds to fund the police training facility, Tony's Pizza Event Center basketball floors, Stone Lake 2, Pheasant Ridge 3, Phase 2, and 9 South projects.
Commissioner Ryan, second.
We have a motion and a second to adopt on first reading ordinance number 21-11055. Could I have a roll call, please?
Commissioner Davis.
Aye.
Commissioner Franz.
Aye.
Commissioner Hoppick.
Aye.
Commissioner Ryan.
Aye.
Mayor Hodges.
Aye. That motion passes 5-0. And then on the financial advisory services.
Commissioner Ryan, Mayor, I move we authorize the city manager to sign the financial advisory services agreement with Steeple, Nichols and Company.
Commissioner Davis, second.
We have a motion and a second to authorize the city manager to sign the financial advisory services agreement with Steeple, Nichols and Company. Could we have a roll call, please?
Commissioner Davis,
Aye.
Commissioner Franz,
Aye.
Commissioner Hoppick,
Aye.
Commissioner Ryan,
Aye.
Mayor Hodges.
Aye. That motion passes 5-0. There is no development business. Is there anything that the commission would like to bring up under other business? I have one small item myself, but we'll proceed with the other members of the governing body. Oh, okay. I just wanted, in light of our conversation, I think last week and the week before, I just wanted to reassure you that we are moving forward to get some strategic planning of some sort done as soon as it can, as we can respond to that. I went back and reviewed Commissioner France's earlier suggestions in regard to our process and have spoken with him and with City Manager Mike Scragg. And I think that when you take a look at the things like the American Rescue Plan funds, our Parks Priority and Deferred Maintenance List, all the infrastructure that we've got coming up, obviously, we're going to need to have some pretty deep discussions about how our future budgets reflect our priorities. So I'll keep you posted on that, but I did want you to know that we are working on that going forward. And that's all I have. So if nobody else has anything, I would accept a motion to adjourn.
Mayor, I move we adjourn.
Second.
We have a motion and a second to adjourn. All those in favor, say aye.
Aye.
All right. Thank you. We will see you here next week.